Right now in the state of Washington, we are in dire need of more behavioral health providers, especially for children, adolescents, and families.
The Master's in Applied Child and Adolescent Psychology program at University of Washington is a 15-month program. The goal is to train future clinicians in evidence-based practice so they can go out in the community and work with youth and families in different clinics.
I received training in trauma-based interventions, dialectical behavioral therapy, cognitive behavioral therapy, and parent-child interaction.
We also talked about the ethical dilemmas of giving somebody a diagnosis. So what does it mean for you to put a label on a person and then that follows them in their medical record? It really allows us to think more critically about, the long-term impact we can have with a client.
Having a foundation of evidence-based practices allowed me to move into the therapeutic space, knowing that I had the skills that would lead to more durable outcomes with clients.
It's 15 months, which is pretty accessible for a lot of us who maybe can't commit to a really long program.
Going back to graduate school is not always an easy venture. My professors understood this and were able to provide me support. They were always rooting for us to complete the program.
All the teaching faculty are practicing providers or have been, and so they really get to share their expertise in different areas.
They have that hands-on experience and can relate to us as new professionals that are going into this space and trying to cultivate those skills.
The practicum experience is about a year and allows students to take the concepts they learn in class and apply them in real life under the guidance of supervisors that may have different styles or approaches to things.
And so after a few months of getting started in the program, you get to really jump into that experience of working with clients.
And then the coolest part, I think, is you learn it in one class one day and then the next day you're actually with someone in front of you using the skills.
I thought it was really cool that we all were in different settings, and then when we came back into the classroom, we were all able to kind of share our own experiences from these settings and learn at the same time.
That was one of the best parts of the learning. People are going through similar experiences, but at different practicum sites and bringing their own life experience.
It was just really cool to see that we all grew through this experience and we transitioned from students to colleagues in the field.
I was really surprised by the diversity of the people within my cohort.
The program's done a really great job of making us well known in the community and has great partnerships with a majority of the community mental health organizations in Seattle and surrounding areas.
At Seattle Children's, I worked alongside so many talented professionals. Also, I was able to do kind of more on-the-spot interventions, and so I had to think on my toes.
Students are matched based on kind of training goals as well as experience that they want to build on.
My practicum placement definitely helped me get my foot in the door with a number of the interviews that I was going on after. It was really powerful to walk into this program and have those connections already made.
Students are all assigned an advisor that's a part of the faculty, and so they meet with them regularly, make sure they're achieving their goals in their program. They support them with identifying jobs after the program. And all the teaching faculty too are also open to just meeting with students, connecting with students to support them during the training year, but also as they go on in their careers.
I feel like I had 20 mentors in the program. I really met some amazing people who really motivated me throughout the program. That facilitation and that networking really made post-graduation a lot easier.
This program really changed my life. I didn't quite know how I would make that pivot. I knew I wanted to step into a new career. Being able to have the foundation of skills, to have professional connections, and to have sort of a game plan laid out for me really helped me figure out the pathway to having a dream, to making it happen, to actually stepping into the practice of working with clients.